In this demo today, we're going to present to you how to use HealthServes to manage a hospital. Now, the first process on the onboarding is to register your hospital account and create a portfolio to run your activities on in HealthServes. So you have to start by visiting HealthServes by click HealthServes Health as written serves with x.org, then enter. That will bring you to HealthServes. Serves with S. Alright, so once you're here, you click on this icon on the top right corner with 3 horizontal lines within a square. Click on it. It will expand the menus we have on the left. So click on register. It will have a drop down. Since you're registering a new institution, click institution registration. And you're going to have this form. So go ahead and fill this form as completely as possible. Fill everything so that you will not have the system prompting you that you can't register, that your form is not complete. Fill everything as much as you can. Then for you to have 1 month free access to use this solution, that place written promo code, enter digital health, one word, all in capital, digital health, enter it here. That is your promo code, digital health. Then if you have your hospital logo, upload it here. Click on this icon and then fetch your logo and upload it there. From here, upload file, you click on it. So once I click select a file, I click OK, it will open where I can select a file from my computer or from my system. Alright, so sorry, first of all you have to click on choose file here, brother. Click on choose file. So you can now select a file you want to upload as your image here. So once you select that file, you can now click on upload file for you to attach it to your form. And once that is done, click I am not a robot and then click on register. Then you get your ID. Go ahead and log in. So login, you click on login. Now this is a login interface. So you either use your email or the user ID of your institution. So the user ID of a hospital start with HOX. So HOX 011. So that is it here. And click I am not a robot as well. Go ahead and log in. Now you're in. You see this round gray colored button with 3 white horizontal lines. Click on it. Once you do that, it's going to expand the main menu of the software. Now the first thing you're going to do is to start to onboard your staff into the account so that you people can now form a team for your institution. So to do that, click on enroll/delete staff. That I have done. Now there are 2 options to do this. That very place where you registered your hospital account at the home page under registration, there is a drop down that has patient, staff and institution. You can send your staff to go there and register the account on healthserve.org, and then they will give you their staff ID. You click on enroll. Let me do it again. They get an ID, staff ID. So you click on enroll staff. And according to their job, they have to create an account according to their job role in your institution. Maybe a physician, a nurse, a pharmacist, a lab scientist, a lab technician, a technician, whatever is their role, an admin, account, all these are there. So they enter their user ID assigned to them by the system and click enroll. But in the event that they have not done that and you want to create for them yourself, you click on register new user. So you go ahead and fill this form with their details, most especially their email and phone number. Phone number is somewhere there. Yeah, this is the phone number and their phone number. And the phone number should be typed in this manner. Remove the country code and put every other detail inside 08034, just like that. So remove the country code, but that number as written on the by network provider should be added. You don't remove the zero at the front. All right, this is the physical address of the patient, of the staff, sorry. Then the image of the staff is optional. If you don't want to put their image, it won't stop you from creating an account for the person. Now you need to declare the profession of the person. Select profession. So click on it. Select the profession of the staff you want to add to your hospital. So you can see we have many types of staff here: medical psychologists, medical lab scientists, med lab technician, nurse, optometrist, pharmacist. So you assign them role according to their job. You create an account according to their job. Then you click on add staff, and it will automatically be added to your list of staff. And where do we see that? So if you go to enroll like delete staff, below it you say staff record. These are all the staff we have here. I'm using a mobile device. If I'm to be on a computer, I'll be able to see this at a glance. So if there's any staff you want to remove at any time, maybe they are no longer in your hospital, simply click on delete staff. And if I say yes, the staff will be knocked off your system. They won't be able to gain access again to work as a staff in that place. So, but if you don't want to remove them, as in this case, I click no. All right. So this is how to add and remove staff in your hospital. Now this is done. Let's open this once more time. Having added all your staff, the next thing you need to do is to select those that will be having role to play in the lab. And this is where to do that. So you can see all the staff you have added. Those that have role to play in the lab, we're in the lab section. This is ultrasound, this is x-ray. So we'll go back to lab. So those that have role to play in the lab, turn on their access button, so that they can have access to run tests in the lab. Right? So that's how to add the access to those that have a role to play in the lab. Basically, those that have to collect sample and run a test and upload the result obtained from the test are the people that you give access in the lab. Then those that also operate X-ray, do X-ray image capturing, upload it, interpret it, and then print result. Anybody that have any of this role to play, you also give them access under the X-ray section. And ultrasound, two of them is just the same. Just give them access to that. And also in your final result, you can see you have a finding, impression, clinical comment. If you want to change any of this title in your final result, you can change it using this input field, and you click update. But because your mobile device is not showing us properly the way you have to see it on a computer. All right, we are done with medical investigation and adding staff to play that role. Then the next is set service price. Those services you provide, like lab tests, vaccination, x-ray, ultrasound, and even other services, maybe like blood transfusion, surgical procedures, comes under other services. You capture them here with their values. Can maybe a patient admission, pint of blood, and all of that. You can actually capture all this under set service prices. All right. So, but let me try and open the lab test so we can see what we need to do. Lab test. So this is hematology, complete blood count, different blood count, chemistry, cerebrospinal fluid test. So you just simply click on this add price and service cost, and it will open this. But sorry, because we are using mobile, it's not optimized well on the mobile. You use computer for this process, but we are also going to optimize it on mobile too as well. All right. So once you do all of this, you click update. Once you finish adding price, you click update. All right, that is about adding prices. Then lab reference. Your lab reference. By default, every test here has a lab reference for those that requires lab reference, reference rather. But if the value you have there is not in sync with what your machine recommend or specification on your machine, you can modify it by clicking on this add new value. Go ahead and look for that test that doesn't have the right value for you. Maybe it's complete blood count, platelet count, for instance, or differential white blood cell count. It can be anything, or chemistry, maybe it's sodium. You click on it, for instance. So you can see the value here. This is the value. So as when I want to change this value, I can simply edit it and then click update, and that will become the value in my institution instead of the global value that we have set in this system. This allows you to customize the lab reference according to your need and what your machine specifies. Then the next one on here is the documentation record, where you have all the documentation you're doing. You have your patient register, all the patients that have visited your hospital, they are all here. This is where you have all the database, all your patient details that are here. All right, so having looked at all of that, this every document you want about what you're doing in your hospital is accessible from here. We also have telehealth services. Here, people can discover your facility, find out about what you do, your services, and they can consult you. They can book appointment all from here. We have various sections: hospital, pharmacy, lab, and the professional group. Then the next one is a patient visit record. These are where you have record of all the patients that have visited your facility. Then they have a drug labeling system, also have drug labeling system, and it flows from prescription from the physician. So you can see we are on the prescription section. So drug dispensed by the physician will be here, and even the amount the patient pays for that. So if I want to see drug under the fund that has amount of 3,900, I click on view, and it will open the drugs there, and these are the drugs. So for me to print this label, I simply click on edit, and it will open this. I click on print label, and the label will be generated. You can see the label is generated, and you can print it from your label printer. You can see the label print generated for this prescription. So that is how it is. And with this label printed, if you scan this QR code we're looking at, it can help you to actually verify the source of this medication. And even this labeling to have the label setting function. Here you can customize the label the way you want it for your facility, and you can even put your logo. You can see where to add your logo here. Label setting, this is where to add your logo. So you can pick your logo from the system and upload it here, so it will appear on your label. All right. Then this is appointment management. All the people that you have been given appointment, this is where you see them manage appointment. Communication setting. This system have audio, video, and live chat, and even SMS. Here is where you do all the adjustment. It has also function for health management, organization, interaction, and interface in terms of third-party payee. You do all of that here. But in a future video, we're going to show you a more comprehensive review and training on how to use all these tools. You can see you have a lot of function on even how to enroll a patient or enrollees for health insurance subscribers. Then we have also the HMO bill management system. We have bill and commission management for those that have referral coming from other healthcare providers and you have to pay them some commission. Here you do all of that. Here is commission management system. You have, they can share with them how much they have earned and all of that. All right, you can see revenue. Also revenue is here, how much you have made and how much each of your staff that are collecting money has collected within a given period. You can manage all of that here. All right, and commission by the various providers that are working with your institution. All right, moving forward, we see look at the end commission. So we see every person who is using HealthServe or who knows about HealthServe as a potential part of the extended ownership system, in that whenever you refer somebody to use HealthServe and the person pays and start using it, you earn a commission. And how does this work? Let me click on earn commission. Now every provider on this system has a unique link that you can use to refer somebody to onboard on HealthServe. So their link is here. Once you click on this, you are going to copy your link. It says share your unique referral link. Just click OK, and your link is copied. You can paste it, you can share it with the person wherever you want to paste it. Link is already copied by clicking on copy referral link. Is already copied. Now what happened? When you share the link and the person eventually signs up using that link, you will see the person that you have referred here on this on the list down here. And if the person eventually pays, you will see the person on the list of paid referral from you, and the amount you earn will appear in your wallet amount here. And you can request for withdrawal by clicking on withdraw amount button. So you can withdraw this money. Once you have made earning from here, you can withdraw it and it will be sent to your bank account. So we see everybody who is using HealthServe or who knows about HealthServe as a potential affiliate marketing team that can earn commission by working with us. Right here you can see all your staff activity. Under staff activity evaluation, you can see the activity here. Your telehealth, where you can make consultation with virtual patients that want to interface with your institution. All right, and there's something I did not address, which is how to register patients from here. Any of your staff can register patients in your institution once you enroll them, and this institution too can also add patients as well. So this is where to add patients. Once you fill this form, you click on add patient and the job is done. The patient will be added in your system. All right, so at this point we need to see how the staff can use this system. So I'm going ahead to log out from this account, and I will immediately log into a staff account so that we can do that. So to log out, this icon that look like shape of a house is where the logout is located. So I click on it and I click on logout. I log out. Then I want to log in as a staff. So I'm going to use a staff, either email of the staff or ID of the staff to log in. So this is the staff ID I want to use. So the moment the staff put their ID after you have been enrolled, the institution where you have enrolled them will pop up from here. And I want the person to log into this because the person has up to 3 places where his account has been enrolled. So I check this, I'm not a robot, and I log in. Now the staff is in. I open it as the staff menu. These are the functions there. So here they can add a new patient just like the institution was doing earlier. So sorry, this is attend to patient. Add patient, register new patient here. So this is the form for them to register a patient in your facility. Once they're done filling this form, they click on add patient and the patient will be onboarded. So after adding a patient, the next thing is for them to attend to patient. So they click on attend to patient. So on attend to patient, there are many ways to do that, but I want us to focus more on attend to patient via phone number, which is at the last option. So I click on get started. So what do we do here? You simply enter the patient phone number. So that's what I want to do now. So I enter 08034891115. Now something happened. Even as you have this phone number, if you create your own account on this system and want to do the same thing, you won't get this file. The reason is because the patient was not enrolled in your institution, and they will have what we call default password that ensures that you can't access patient folder just by knowing the phone number, unless you are working in the institution where the patient has been enrolled officially. Otherwise, if you have this phone number and try to log into it, you won't get this folder because it is passworded. There is a default password. So that means when you're creating a patient folder, you need to set the default password for that patient for security reason, and you must set it because system will not allow you to create a patient folder without a default password. So having said that, once you enter the patient phone number in the institution where the patient is already registered, you click verify. When you click on this verify, we even have visions for virtual consultation, and that is why we have options like the live chat, the audio call, the video call, so that you can even attend to patients while they are at home. You can call them up and you start conversation with them over the phone via visual consultation. We already have plan for that. We even have SMS too, so you can actually send message to your patient even if they're not physically present. All right. Then you can review previous documentation on this patient folder from here. They're all here. All the previous history of this patient are located here. Drug test done, lab test, everything is here. So you can see this is a lab test. This is a antimicrobial resistance test, MCS. All right. So we have done reviewing what is in the patient folder, how the patient folder look like. Now you want to create a new record. Here is where to do that. Create new record. So once you click on this, this is where you create a new record. So you can even admit patients for those that have that function, like the nurses, the physicians, and some other person that have the tool to admit patients in the hospital. They have admission to, there's antenatal tools, there's delivery tools, family planning. This is for family planning here. Then this is for other services like those bills we talked about, like maybe billing for those services. Prescription tool is here, medical investigation, point of care testing, inpatient, clinical clerking, comprehensive clerking of the patient is here, nutritional management, referral, appointment. All right. But if a patient is a male, you will not have antenatal and delivery function in the documentation tool. So this patient is obviously a male. That's why there's no antenatal and delivery tools here. All right. So if you want to clerk a patient, you click on clerking. You can see the function pop up: patient complaint, past medical history, history of present illness, family, physical examination, and all of that. There's so much to do. Review of system, physical examination, diagnosis. So then after doing this, you can now send to lab. Maybe you're not sure of what the problem is. You can use the lab tool. So and under here, you go to lab, hematology test, complete blood count, differential blood count, chemistry, cerebrospinal fluid, stool test, microbial sensitivity test, sperm biomarker, sperm preparation, wider test, microfilarial test, malaria test. So many to do. So once you select all the tests you want to run, let me just do that with just a few under, okay, here hematology test, and I selected hematology. Let me refresh the system. I think it did not load well. Okay, so I click on the medical investigation, then I go to lab test, hematology. All right, so you can see what I did. I refreshed the system so it can load properly. And maybe I want to do bleeding test, prothrombin time, erythrocyte sedimentation rate, blood group, genotype. As I'm doing this, the value for these tests are popping up here. You can see these are the value of all the tests I've selected so far from what I've done here. Let me also add genotype. All right, so I've selected all these tests. Simply click on save. Okay, now you go to billing. You go to billing, and remember it's lab test. So this is the lab test, and all the tests I've selected are here. 10,500. That's what we selected, the value of the test. So click on add in billing tool. You click on this. You can see out of pocket payment. This system has health insurance option of payment, but this patient does not have such plan. So you click on add item. Now the item is already added under bill. This is billing tool. It's at the bottom of this page. Billing tool. Every detail about this bill is added. So you click on save bill. Saved. So now those in the account, it's their job now to collect this money, and they will do that with their own, from their own end. All the same is connected, is synchronized, so they will be on receive payment, and they will see this bill coming. That is the bill unpaid, and the amount is 3,500. 3,500. So you click on receive. Is it cash, POS, whatever it is? So it's cash. Let's assume it's cash. Save. Okay. Done. So you can print invoice. You can print invoice and give to the patient from here. This is the invoice. It has both. This is for thermal printer. This is for A4 printing, the one at the top. So you can print the invoice and give to the patient. Right? Having done the test, let's now go and run the test in the lab. So this is the test we just selected. 3,500. You click on edit. It's paid already. Then the specimen collection time is today, set. Then report release time will be today, set. Now this is the test. So you can run the test and upload the results. So let's assume it's AA. This one is A positive. So this one, the patient is a male. So we have to select the male option from the drop down. Male, assuming with this is men from above 50. Men 0. This is for men and this is for men above 50. So this is one we're looking for. So the value is 0.15 mm per hour. So we put 10. Then the other value reference is 10 to 14. This is the prothrombin time. That's prothrombin time. So we put 12 here. We are rounding up. Then the last one is 3 to 9 minutes. This is the bleeding time. 3 to 9 minutes. So we'll put 6 minutes. So we're done. If you want to interpret this result, this is where to do that. You can write any content you want to put here. So once that is done, you put the name of the person that are approving authority for this test. Assuming, for instance, is this person. We click on that and you click on save. Click OK. Then click generate report. And that is your test here. Let me close this so you can see the test. This is the test result of this patient for this hematology test. So you can do many type of tests all at the same time, and then we'll classify it section by section, maybe hematology, complete blood count, different blood count, and all of that. So this is how the system takes care of your documentation. And you can see the QR code here. This QR code will help you to make sure that this result is not altered by anybody. If anybody alters this result as written here, when the receiver scan this QR code, it will show the person that there is already an alteration in the result once it is scanned. So this is a new innovation in the ecosystem. So and it's something that we want our people to embrace. So that will help to increase confidence in your result and also improve the accuracy in diagnosis, and for whatever reason the test is ordered for. So I want to join us in this mission to transform healthcare delivery in Africa and the rest of the world. But it begins with you. Our job will not be complete without your collaboration. So you're our partner and we look up to you for your support for us to accomplish this mission. For you to reach us, you can call us on +23 81 88 88 7036. Thanks for watching, and to sign up, you go to your healthserve.org and click on registration, and